My inspiration to be a doctor was I was always interested in science, and so when I was 9 to 12 years old, I had a paper route, as a lot of budding kids did. And so, but on my paper route was our local hospital. So I went floor to floor, room to room, selling papers for 25 cents. And I was pretty motivated to sell papers, so there wasn't a door I wouldn't open. And I would open the patient's doors, and I'd see people in all these different states. I always liked when people had a baby. Like if somebody had a baby, the dad would buy 4 or 5 papers to get the announcements. And so I just, everybody at the hospital knew me. I talked to everybody from the cafeteria workers, the nurses, the doctors, and I just love being in that environment.
Moment I'll never forget as a doctor is actually seeing a mentor chuck his keyboard across the room after being forced to utilize an EHR for the very first time.
It's being in a situation where there's financial constraint, where someone won't get a test, and there's programs you can hook people up with and resources, but when people can't take time off work because they literally are going to lose their job, they can't put food on their table, but they have an injury that's only going to get better with rest. So the social part of being a doctor and trying to get people the help they need.
A message to physicians out there: there's a lot more I came from. There's a lot of physicians, clinicians in the field on the IT side really advocating for what's best for our practice, what's best for our patients. So this industry has come a very long way. Many more clinicians have joined, and we have a much greater voice in the IT community, as you could tell here at Altera.
And I'd like to give a shout out and a thank you to all the doctors. As I get a little older, it's been interesting to be on the patient side, right? Need that cholesterol medicine, treat your high blood pressure. And my friends, who are mostly doctors as well, we keep talking about, well, who's going to take care of us? And I'm pretty excited that I'm seeing a lot of younger physicians who have that zest for care and the impact and really keeping it human. And so I appreciate everything they're doing to keep this great profession going.